CLABSI control, 2RN CVC dressing change. Always sanitize or wash your hands when you first enter the patient's room. Introduce the second RN who will be helping with the dressing change and explain to the patient what exactly you will be doing. You want to start out by putting on clean gloves and grabbing at least 3 masks, one for each nurse, one for the patient, and anyone else who is standing nearby in the room. As you will see later on, the second RN can be helpful in many ways, such as providing additional supplies and helping with the patient's position as to not contaminate the sterile site once it is cleaned. This approach was designed to create a more efficient dressing change to reduce the likelihood of our patients developing central line-associated bloodstream infections. After removing the old dressing with Detach-All to prevent skin tears, the primary nurse will remove their clean gloves and rewash or sanitize their hands prior to putting on their sterile gloves. Depending on your preference, you can choose to use either the CVC dressing change kit or you can make your own. Either way, you'll need to create a sterile field with appropriately sized sterile gloves, ChloraPrep, skin protectant, and the new Tegaderm dressing. Since you will already be wearing masks, it is okay to remove the ones from the kit. And if you decide to bring in a different size pack of sterile gloves, exchange those for the pair in the kit as well. Take note that the individually wrapped sterile gloves are white, while the ones in the kit are blue, not to be confused with the clean gloves that are still being worn by the second RN. With ChloraPrep, scrub the insertion site in a back and forth motion for at least 30 seconds. Need more supplies? Not a problem. The second RN can easily help out so the primary nurse doesn't have to break sterile field or waste time grabbing more supplies themselves. This also decreases the time that the insertion site is exposed to open air. While we wait for the ChloraPrep to dry, it's time for the primary nurse to stand back with their sterile gloves and admire the work they've done so far. And what a perfect time for the patient to reach up and touch the site. Good thing we have a second RN. Imagine having to start this whole process over if the sterile field was broken. Given how fragile and sensitive the patient's skin often is, always use skin protectant before applying the new dressing. Now look at that teamwork. Tegaderm can be tricky to apply, especially with the angle of the neck. The second RN can help make a clear surface area to ensure proper application of the dressing. After all, we want it to last the full 7 days. Remember to sign the new dressing with the date, time, and both RN initials. The primary nurse will also document the dressing change in CareConnect. Take credit for what you have done, which is decrease the patient's likelihood of getting a central line-associated bloodstream infection.